Dr. Kamla Fartyal, Group General Manager from NHPC. I am Head of Medical Services Division in NHPC. And this is our journey through COVID, how we managed to manage COVID during patients during COVID times. It's a retrospective study. So I would like to tell you something about my organization. NHPC is one of the largest hydropower organization. It's a mini Ratna company with capabilities to undertake all the activities from conceptualization to commissioning in relation to setting up of hydropower plants. It is also diversified into various fields which include solar and wind power. As on date, we have installed base of about 7,071.2 megawatt from 24 power stations. And within the next 5 to 10 years, we intend to go up to 50,000 megawatt. Our journey and initiatives of NHPC to fight against COVID-19. COVID-19 has caused a huge loss to mankind, and at the same time it has taught us how we can live with so many things which we often think we need, and how we used to perceive that these were indispensable in our day-to-day lives. This is about NHPC's journey towards precaution, prevention of the spread of COVID-19, a severe acute respiratory disease outbreak which took the form of global pandemic. At the outset, when nothing was known about novel coronavirus, we took this decision to send one of our doctors to attend the first master's training workshop on COVID-19 arranged by Delhi government to train their doctors at Secretariat Delhi government in March 2020, which was uninvited, but we did send one of our doctors there. We organized one of the numerous webcasts across PAN NHPC, wherein we disseminated information to all our doctors, paramedical staffs, and then to our employees across all projects and power stations regarding preparedness, management, and preventive measures for COVID-19. Since the onset of the pandemic, NHPC employees are being continuously educated and apprised about the importance of COVID-appropriate behavior, wearing masks, hand washing, using of sanitizers, and keeping physical social distance through all the possible mediums like SMS, WhatsApp, posters, codings, webinars, and e-lectures. When personal protective equipment was scarcely available in the country, during lockdown period, we not only arranged but delivered these articles to all our project sites which are located at very remote locations in Himachal Pradesh, Jammu and Kashmir, Arunachal Pradesh, Manipur through roadways, and for Manipur we sent it through the airways with the help of Indian Army. We even distributed these items to various state governments, district and rural hospitals, as well as to the local population. Thermal scanners were provided and sanitizers were made available at each and every entry and exit points in all the common locations in our offices. Intense disinfection drives were regularly carried out before opening all the office complexes. All day-to-day working of offices started using contactless e-office and virtual platforms. Operation of NHPC power stations and projects ensured with just optimum manpower, and that too with staggered timings in order to reduce crowding and to restrict unnecessary movement of people. We at NHPC followed all the guidelines issued by the Ministry of Home Affairs, Ministry of Health and Family Welfare, and Ministry of Power from time to time. Guidelines were issued to all the projects and power station regional offices to promote and incorporate COVID-19 appropriate social behavior among the masses. We conducted many rapid antigen tests, RT-PCR camps, IgG antibody screening camps with the help of different agencies at our offices, projects, power stations, for all our employees and their dependents, our retired employees and their dependents too, and also for central public sector undertaking beneficiaries, contract employees, as well as for the locals who are residing in the vicinity of all our project areas. All the while, we were in continuous touch with the district and state authorities regarding occurrence of new COVID-19 positive cases in all our locations, projects, power stations. All the efforts were taken to trace suspect cases and their potential contacts in order to isolate them and control the spread of the disease. NHPC doctors managed all the employees and dependents with minor and moderate symptoms. However, some patients who had serious problems were managed to shift to designated COVID-19 hospitals for further management. All the contact history of the patients were traced and monitored regularly for any symptoms. They were advised for tests and quarantine, initially for 14 days and in Omicron for 7 days. Retired employees and their dependents with COVID symptoms were also monitored and managed similarly. Home quarantine patients were given a list of parameters to be observed at home to follow for their well-being and proper care at home, and their daily status of all the home quarantine patients were monitored and reported by all the doctors, and we used to take a consensus in the evening, and we used to look at those patients who were sick and those who can be monitored at home quarantine, and those who were sick and needed to be transported to the hospitals, we shifted them up mostly within the time so that they didn't go into serious problems. Information regarding COVID-19 and their possible contacts were shared and discussed with the management as well as the Integrated Disease Surveillance Officer. In all the projects and power stations, project doctors monitored employees, their dependents as well as members of the local population who were quarantined by the state administration at our centers. We supported our patients on 24/7 basis. Our doctors were all the time available for the patients who had any health-related issues. During the second wave of COVID, we not only treated and assisted COVID-19 NHPC beneficiaries, but also other CPSU patients as well as patients from the Ministry of Power. And to get admission in various hospitals in Delhi NCR, there was an acute shortage of COVID-19 beds in the entire country. We also assisted them to get life-saving drugs, anti-sera, food, oxygen supply, etc. by forming specific health groups for specific regions. Different locations had different groups, health groups where they all gave all the supports. All employees from different departments came together in that health group and they used to assist all the doctors in providing support. During the second wave, we even hired a 35-bedded nursing home at Faridabad for our COVID-19 infected employees and for their dependents and retired employees and their dependents and for CPSU beneficiaries as well as patients from Ministry of Power. On the behest of Government of India, when the indigenous vaccination program against COVID-19 was rolled in, we were the first among the PSUs to procure and deliver cold chain equipment to receive and store vaccines at the doorstep of states of Jammu and Kashmir, Himachal Pradesh, Arunachal Pradesh and Madhya Pradesh under the CSR program. We airlifted some of our severely ill patients from far-flung areas of Jammu and Kashmir, Leh Ladakh, northeastern states to better health care facilities at Delhi NCR in order to save their lives. We took the help of Indian Army and Indian Air Force for airlifting our patients from Leh Ladakh and also from Jammu and Kashmir. During the lockdown, when arrangement of blood was a big challenge even for all the tertiary care hospitals nationwide, across NHPC we arranged about 900 units of blood through blood donation camps. 3 post-COVID camps were conducted for COVID patients with the help of specialists, including psychiatrists from different hospitals. We organized series of COVID-19 vaccination camps at all our locations for the benefit of our employees and their dependents and the retired beneficiaries, for various CPSUs and MOP beneficiaries as well as our contract employees. We ensured complete vaccination of all age groups as per the guidelines of Ministry of Health and Family Welfare. 3 oxygen generation plants were dedicated to the nation by NHPC during the second wave of COVID-19. NHPC also set an example of harmony by providing food and medical care to hundreds of Nepali citizens stranded at Indo-Nepal border in Dharchula. Now there are some of the visuals which I would like to show through the journey of NHPC. This is airlifting of critical care COVID patients. This is our blood donation camp which was conducted during the 46th raising day. And this is the vaccination drive which was done in different projects. This was done in Delhi. We couldn't do it in Faridabad, we didn't get permission, so we did a vaccination camp in Badarpur, NPTI complex in Badarpur for all our employees and the CPSUs and Ministry of Power employees. This is oxygen plants being dedicated to the nation. Our chairman providing financial assistance of about 2 lakh rupees to the Red Cross Society Faridabad for COVID-19. And this is the medical care and food being provided to hundreds of Nepali citizens at Dharchula. The distribution of food was done during COVID-19 to all our affected employees and their families. That's all. Thank you very much.